forced to do this ultrasound with a partially filled urinary bladder because the patient comes with severe right lower quadrant pain and the history of PUO. बेटा बुखार कदों दा हो रहा है? काफी दिन होता है. Okay. Here is the uterus in longitudinal section. Now you see that this is the urinary bladder. This is the uterus. This area is uterus. This is the cervix of the uterus, quite thick, bulky, and the central hypoechoic area is the cervical canal. Now this is fluid collection posterior to the uterus and is extending towards the right lower quadrant. This is fluid with internal echoes. So this is uterus. This is the anterior segment of the uterus. This is the fundus. This is the posterior segment, and this is the cervix. And this is the cervical canal. And this is the fluid that you are seeing posterior to the uterus. And in the fluid you can see there are internal echoes, debris with fine septas. This is a case of, in fact, induced abortion. And see the size of the cervix. Cervix is significantly bulky and large, marine 40 into 37 millimeters. And this view that you are seeing is a longitudinal view of the pelvic cavity in the female. Now see this area, concentrate on this central area. This is where the endometrial canal is, and we are seeing that the endometrial canal is dilated up to 20 millimeter. Normal should not exceed more than 14 millimeter. Moreover, you are seeing echogenic material within this. You are seeing fluid. This is fluid. Then in the fluid you can see this echogenic area, and then in this echogenic area you will see tubular structure. So these are RPOCs, retained products of conception. RPOCs. बेटा कितनी देर का अमल से? कितनी देर का अमल से? हैं? He had an abortion from an unqualified person, LHV, or in our areas, really people go to. Now I am focusing only on the endometrial canal. Just focus on the endometrial canal, forget about everything. This is the endometrial canal with this is fluid, black area is fluid. This is the internal echogenic area. These are a few fetal parts. So these are the retained products of conception in an enlarged and bulky uterus. This is the fundus of the uterus, anterior wall and the posterior wall. This is the urinary bladder, and this is the fluid posterior to the uterus in the pelvic cavity with a lot of internal echoes, and you can see that. And the echoes are because the PUO that she is saying is because of this fluid that is collected within the pelvic cavity, and when the fluid contains such echogenicities that you are seeing, it means that the fluid is infected. this is the endometrial canal. This is the magnified view, and you are seeing shadowing also from this echogenic area. Posterior shadowing is seen through this echogenic area, and this is possibly retained product of conception that we say are POCs with internal debris, pus, bleed, and you see that the endometrial canal is dilated up to 22 into 13 millimeter, contains a lot of debris along with fetal retained product.